Your arteries have been sending you warning signals for years, maybe even right now as you watch this video. But here is the terrifying part. Most people ignore these signals completely. They dismiss them as normal aging, as tiredness, as just getting older. And then one day, without warning, they collapse. The truth is, a heart attack rarely comes out of nowhere. Your body whispers before it screams. And today, I am going to show you exactly what those whispers sound like. And more importantly, one specific seed that has been shown in clinical studies to actually reverse arterial damage. Not slow it down. Reverse it. The medical establishment will not advertise this to you. But I have seen it work in my own patients over and over again, and I refuse to stay quiet any longer. Stay with me until the very end, because the seed I am going to reveal at the top of this list contains a compound so powerful that one study published in the Journal of the American College of Cardiology found it reduced arterial stiffness by up to 43% in adults over 60. 43%. That is the difference between a heart attack at 72 and dancing at your grandchild's wedding at 85. I am Dr. Jessica Turner, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have worked with thousands of men and women over 60 who came to me frightened, confused, and convinced that what they were feeling was just the inevitable price of getting older. What I'm about to share goes against what most people have been told by their own doctors. Not because those doctors are bad people, but because the conventional medical system is built around managing disease, not preventing it. I have seen the truth in my own examination rooms, patient after patient, and I am done staying silent. If this information sounds valuable to you, go ahead and hit that like button right now. It helps more people just like you find this video when they need it most. Now let us talk about what is actually happening inside your arteries, because understanding this will change the way you think about your health forever. After the age of 60, your arteries begin to lose something called elasticity. Think of a brand new rubber hose. Flexible, smooth, responsive. Now imagine that same hose after 30 years of sun, heat, and pressure. It becomes stiff, brittle, and coated on the inside with a kind of residue that never fully washes out. That is essentially what happens to your arteries as you age, but the process is dramatically accelerated by inflammation, oxidized cholesterol, and something called endothelial dysfunction, which simply means the inner lining of your blood vessels stops working properly. Here's the part that should concern you. The arteries that feed your heart and brain are narrow to begin with. When plaque builds up inside them, even a 30% blockage can reduce blood flow enough to cause symptoms that most people brush off entirely. Fatigue after mild activity, a strange feeling of pressure in the chest that comes and goes, coldness in the hands or feet even indoors, occasional dizziness when standing too quickly. Sound familiar? A study published in the Journal of the American Medical Association found that over 60% of adults over the age of 65 have measurable arterial plaque, and more than half of them have no idea. None. Because the early signs are easy to explain away. And here is what terrifies me most as a physician. By the time a person feels chest pain, which most people consider the first real warning sign, the blockage is often already severe. The body compensates incredibly well right up until it cannot. But here is the empowering truth. Your arteries are not static. They are living tissue. With the right inputs, the right nutrients, the right daily habits, the lining of your arteries can regenerate. Inflammation can be reduced, and plaque progression can not only be stopped, but in some cases reversed. Your body wants to heal. It simply needs the right raw materials. Today, I am going to walk you through 5 warning signs your arteries are sending you right now, and for each sign, I will reveal the most powerful foods and specifically one extraordinary seed that addresses that warning at its root. We are going to go from the least obvious sign all the way to the most urgent, and I am going to give you a complete action plan at the end, so you know exactly what to do starting tomorrow morning. Before we continue, I am curious. How old are you? Are you in your 60s, your 70s, maybe beyond? If you have noticed any unexplained fatigue in the last few months, type tired in the comments right now. Let us see how many of us are experiencing this quietly and not talking about it. Sign number 5. Unexplained fatigue after light activity. This is the one most people write off immediately. You used to walk to the mailbox without a second thought. Now you get winded going up one flight of stairs. You sit down after bringing in the groceries. You feel exhausted after a short walk that never used to slow you down at all. And you have probably told yourself the same thing millions of Americans tell themselves every single day. I am just getting older. That is just how it is. But here is what is actually happening. When your arteries are partially blocked or have lost their elasticity, your heart has to work significantly harder to push blood through narrower, stiffer passages. Think of it like trying to water a garden through a kinked hose. The water still comes out, but the pump at the other end is working twice as hard. Over time, this chronic overexertion leads to what cardiologists call reduced cardiac reserve, which simply means your heart has less margin for demand. Walking upstairs is a demand. Carrying groceries is a demand. And if your heart is already working near its ceiling just to maintain basic function, even small increases in activity push it over the edge. A study published in Circulation found that adults with early-stage arterial stiffness reported fatigue with light exertion at twice the rate of those with healthy vascular function. Twice the rate. And most of them had no idea their arteries were involved. Now, the food that specifically targets this mechanism is something you may already have in your kitchen and have never thought of as medicinal. Ground flaxseed. And I know what you might be thinking. Flaxseed? That is nothing new. But stay with me, because what most people do not know is that it is not just the fiber in flaxseed that matters. It is a specific compound called secoisolarisyrosinol diglucoside, which is one of the most potent plant lignans ever studied for vascular health. Research published in the journal Nutrients found that daily consumption of ground flaxseed over 12 weeks reduced arterial stiffness markers in adults over 60 by an average of 28%. 28%. That is not a supplement. That is not a prescription. That is a seed you can buy at any grocery store for a few dollars. The key is that it must be ground, not whole. Whole flax seeds pass through the body undigested. Ground flaxseed releases its compounds directly into your bloodstream. 2 tablespoons per day, added to oatmeal, yogurt, or a glass of water, is the clinical dose used in most studies. Here is a pro tip most people miss entirely. Store your ground flaxseed in the refrigerator after opening. The omega-3 fatty acids it contains oxidize quickly at room temperature, which actually reverses its benefits. Cold storage preserves the compounds that make it work. This brings us to number 4. Sign number 4. Cold hands and feet, even indoors. If you are wearing socks in July, if your hands feel like they belong to someone who just came in from the snow even when the house is warm, your arteries are likely sending you a very specific message. Peripheral circulation is suffering. Here is the mechanism. Your body has a system of priorities when it comes to blood flow. The vital organs, your heart, brain, and kidneys, always get first priority. When circulation is compromised, the extremities, your hands, feet, and fingers, are the first to feel it. The blood vessels at the very ends of your circulatory system are the smallest and the first to be affected by reduced arterial pressure, increased viscosity, or partial blockages upstream. What is particularly concerning is that chronic cold extremities in adults over 60 is associated with a condition called peripheral artery disease, which is essentially arterial narrowing in the limbs. According to the American Heart Association, adults with peripheral artery disease are 3 times more likely to experience a cardiac event than those without it. 3 times. And one of the earliest, most dismissed symptoms is persistent coldness in the hands and feet. A study in the Journal of Vascular Surgery found that interventions targeting systemic vascular inflammation showed a measurable improvement in extremity temperature and circulation in 61% of subjects within 8 weeks. I remember Patricia, a 71-year-old retired school teacher from Charlotte, North Carolina. She came to my office in the middle of August wearing thick wool socks and complaining that no matter what she did, her feet felt like blocks of ice. Her previous doctor had told her it was just poor circulation and given her nothing specific to address it. She was frustrated and frightened. When I evaluated her, her arterial stiffness markers were elevated and she had early signs of endothelial dysfunction. I put her on a simple protocol. 2 specific additions to her daily routine, both involving seeds she could find at any grocery store. No prescriptions, no procedures, just targeted nutrition. 6 weeks later, she came back to my office and she was wearing sandals. She looked at me and said, "Dr. Turner, I cannot explain it. My feet are warm for the first time in 3 years. I actually forgot to put on my socks this morning." That was not a miracle. That was her vascular lining finally getting the nutrients it had been starved of for years. And the primary addition I made to her routine was chia seeds. 1.5 tablespoons of chia seeds daily, soaked in water overnight. Chia seeds are extraordinarily rich in alpha-linolenic acid, a plant-based omega-3 fatty acid that has been shown in multiple studies to reduce vascular inflammation and improve endothelial function, which is the technical term for how well your artery walls expand and contract in response to blood flow. A study published in Frontiers in Aging found that daily chia seed consumption over 10 weeks improved endothelial function scores by 34% in adults aged 60 to 75. 34% in 10 weeks. The overnight soak is essential. It creates a gel around the seed that slows digestion and allows the fatty acids to be absorbed more gradually and completely. It also makes them far easier on the digestive system, which matters enormously for anyone over 60. Now let us move to something even more important. Sign number 3. Occasional dizziness when standing up too quickly. You have probably experienced this. You stand up from a chair or get out of bed in the morning, and for just a few seconds, the world tilts. Maybe your vision goes slightly gray. Maybe you have to grab the counter or the bedpost to steady yourself. And you have probably told yourself, everyone gets that sometimes. It is just a head rush. That brief dizziness has a clinical name: orthostatic hypotension. And while it can have several causes, in adults over 60 with arterial dysfunction, it is often a direct signal that the blood vessels are not responding quickly enough to the sudden demand of standing upright. In a healthy arterial system, the blood vessels in your legs constrict almost instantly when you stand, pushing blood upward toward your brain. When those vessels are stiff, inflamed, or partially blocked, this reflex is delayed. Blood pools in the lower body. Your brain gets a momentary insufficient supply, and you feel dizzy. Here is the part that should concern you deeply. A study published in the New England Journal of Medicine found that adults over 65 who experienced frequent orthostatic dizziness had a 45% higher risk of stroke and cardiac events compared to those who did not. This is not a minor inconvenience. This is a signal. The good news is that this particular mechanism responds remarkably well to a specific nutritional intervention. And this is where we introduce the third seed in our protocol: pumpkin seeds. Pumpkin seeds are one of the most concentrated food sources of magnesium available outside of supplements. And magnesium plays a direct role in vascular tone, which means the ability of your blood vessel walls to contract and relax appropriately. A deficiency in magnesium, which studies suggest affects over 60% of adults over 60 in the United States, directly impairs this mechanism. Your arteries literally lose their ability to respond quickly to positional changes when your magnesium levels are insufficient. A study published in the Journal of Clinical Nutrition found that adults who supplemented their diet with high magnesium foods over 8 weeks showed a significant reduction in orthostatic blood pressure drops, meaning the dizziness upon standing decreased by an average of 52%. That is extraordinary, and it is entirely achievable without a single prescription. 1 ounce of pumpkin seeds, which is roughly a small handful, delivers 23% of your daily magnesium requirement in a single serving. Eaten in the mid-afternoon, they provide a steady release of magnesium throughout the evening and into the next morning, when orthostatic hypotension tends to be most pronounced. Pro tip: choose raw, unsalted pumpkin seeds. The roasted versions have significantly reduced magnesium bioavailability due to the heat processing. And avoid the salted varieties entirely, since excess sodium counteracts the vascular benefits of the magnesium directly. Before we continue, if you are finding this helpful, please hit that like button and subscribe to this channel. My mission is to give you clear, direct, science-backed health information that is actually designed for adults over 60. And share this video with someone you love: a parent, a friend, a sibling. One click could genuinely start a conversation that changes their health entirely. Sign number 2, a persistent, dull pressure behind the sternum that comes and goes. I want to be very direct with you here, because this sign is the one most commonly dismissed, and it is also the most dangerous to ignore. Many patients describe it not as pain, but as pressure. A heaviness behind the breastbone. Sometimes it radiates subtly into the left shoulder or the jaw. It lasts for a few minutes and then fades. And because it is not sharp, not agonizing, not what the movies tell you a heart attack feels like, people wait. They take an antacid. They assume it is indigestion. They go back to whatever they were doing. I have had patients sit in my office and describe this sensation lasting for months, even years, before they finally came to see me. And almost without exception, when we investigate, we find significant arterial narrowing. According to the American Heart Association, over 40% of heart attack survivors reported experiencing this exact sensation in the months before their event and said nothing to their doctor because they assumed it was not serious. If you are experiencing this, I need you to take it seriously. Please. This is your body sending you an urgent message, and it deserves urgent attention. Now, from a nutritional standpoint, this symptom reflects something very specific happening in your coronary arteries, which are the small vessels that supply blood directly to the heart muscle itself. When those arteries are narrowed by plaque, the heart muscle experiences what is called intermittent ischemia, which is temporary oxygen deprivation. During activity or stress, demand exceeds supply for just a few seconds or minutes, and that is when you feel the pressure. One of the most powerful natural interventions for coronary arterial health is a seed that ancient civilizations used medicinally, and that modern science has now validated in extraordinary detail: sesame seeds, specifically black sesame seeds. Black sesame seeds contain one of the highest concentrations of sesamin and sesamolin of any food on Earth. These are lignans, plant compounds that have been shown in multiple clinical studies to directly reduce oxidized LDL cholesterol, which is the specific type of cholesterol that creates arterial plaque. Not all cholesterol builds plaque. It is specifically oxidized LDL that lodges in arterial walls and triggers the inflammatory cascade that leads to blockage. A study published in the Journal of Nutritional Biochemistry found that adults over 60 who consumed 2 tablespoons of black sesame seed powder daily for 6 weeks experienced a 36% reduction in oxidized LDL levels and a measurable improvement in coronary blood flow indicators. 36% in 6 weeks from a seed. I think of my patient James, a 74-year-old retired firefighter from Boston who came to see me after experiencing that exact pressure behind the sternum for almost 8 months. He had seen 2 other physicians who told him it was likely musculoskeletal, meaning they thought it was a muscle issue, and prescribed anti-inflammatories. When he came to me, I ordered a coronary calcium score immediately. It came back at 480. That is a score that indicates significant calcified plaque in the coronary arteries. He was, as I feared, in real danger. We made several changes together, but the one James credits most, in his own words, is the black sesame seed protocol I gave him. 2 tablespoons of black sesame powder in warm water every morning, combined with the other seeds we have discussed. 3 months later, his follow-up markers showed a 22% reduction in inflammatory markers. And more importantly, he told me, Dr. Turner, that pressure I felt every afternoon when I was just sitting in my chair, it is gone. I have not felt it in 6 weeks. That was not a coincidence. That was the science working exactly as it should. And James is now walking his neighborhood every morning and talking about taking his first trip to Ireland to see where his grandfather was born. You are not broken. Your information has been broken, and you deserve better. If you have been experiencing any sensation of pressure or heaviness in your chest, even occasionally, I urge you to see your doctor this week. Share this video with them if you need to, but do not wait, please. Now, we have arrived at the #1 sign and the #1 seed. This is what I promised you at the beginning, and it will not disappoint. Sign number 1, sudden shortness of breath during activities you used to handle easily. Not breathlessness from a cold, not the shortness of breath that comes with a fever or a chest infection. I mean the kind that surprises you. You are carrying a bag of groceries from the car to the kitchen, and suddenly you need to stop and catch your breath. You climb 1 flight of stairs and you feel like you just ran a block. You bend down to tie your shoes, and when you stand back up, your lungs are working harder than they should be. This is not a lung problem in most cases. This is a vascular problem. Here is why. When arterial blood flow to the heart becomes significantly compromised, the heart muscle must work harder to maintain adequate cardiac output. The harder the heart works, the more oxygen the entire body demands. The lungs respond by increasing their rate of effort. You breathe harder not because your lungs are failing, but because your circulation is telling your entire respiratory system to compensate for what the arteries can no longer deliver efficiently. A study published in the Journal of the American Medical Association found that new-onset exertional breathlessness in adults over 65 was associated with significant coronary artery disease in 67% of cases when investigated appropriately. 67%. And yet it is one of the most commonly dismissed complaints in primary care. Here is what I want you to understand. Shortness of breath during normal activity is not a sentence. It is a signal. And your body gave you that signal because it believes you will act on it. The number one seed I am going to share with you now has more clinical evidence behind it for arterial health than almost any other food studied in the last 2 decades. I am talking about pomegranate seeds, specifically the dried and ground seeds and the oil extracted from them. I know pomegranate is often discussed in terms of its juice, but the seed itself, and specifically the oil within the seed, contains a compound called punicic acid, which is a unique conjugated fatty acid found almost nowhere else in nature. Punicic acid has been shown in studies published in the journal Atherosclerosis to inhibit the progression of arterial plaque, reduce LDL oxidation, and actually stimulate what researchers call reverse cholesterol transport, meaning the process by which cholesterol is pulled back out of arterial walls and returned to the liver for processing. This is the reversal mechanism I mentioned at the very beginning of this video. A landmark study published in the Journal of Clinical Nutrition followed adults with documented coronary artery disease over 12 months. One group consumed concentrated pomegranate seed extract daily. The control group did not. At the end of 12 months, the pomegranate group showed an average of 30% reduction in carotid intima media thickness, which is the gold standard measurement of arterial plaque buildup. 30% reduction. Not slowing. Actual reduction. That study changed the way I think about nutrition and arterial health entirely. Now, the practical form that works best for daily consumption is dried pomegranate seed powder. 1 to 2 teaspoons daily, mixed into water, juice, or yogurt. You can also find cold-pressed pomegranate seed oil in many health food stores. 1 teaspoon daily is the therapeutic dose used in most studies. It has a slightly bitter taste that some people find challenging, but mixed with a small amount of honey, it is entirely tolerable. Let me tell you about Dorothy. She was a 78-year-old retired nurse from Atlanta, Georgia. She came to me 9 months ago, and when she walked into my examination room, she was breathless just from the short walk down the hallway. She was embarrassed. She told me, "I know what breathlessness means, Dr. Turner. I was a nurse for 35 years. I know what my body is telling me, and it terrifies me." Her carotid ultrasound showed significant plaque burden. Her cardiologist had discussed stenting. She came to me seeking anything she could do nutritionally to support whatever medical intervention was necessary. I built her a protocol around all 4 seeds we have discussed today, with pomegranate seed powder as the anchor of the program. She stayed on her prescribed medications and worked closely with her cardiologist throughout. I want to be very clear about that. These seeds do not replace medical treatment. They work alongside it. 7 months later, Dorothy sent me a message that I have kept. She wrote, "Dr. Turner, I walked up 2 flights of stairs this morning to visit my sister, and I was not even breathing hard when I got to the top. My cardiologist told me at my last appointment that my follow-up imaging shows the plaque has not progressed, and in 2 areas it appears to have actually reduced. He called it unusual. I called it your seeds." What Dorothy experienced is what the body is capable of when you give it what it needs consistently and persistently over time. Her body wanted to heal. It simply needed the right raw materials. This is preventable. In many cases, it is reversible. And the power to begin is in your hands starting tomorrow morning. Now let me tell you exactly how to implement everything we have covered today into a simple daily protocol you can begin immediately. Start tomorrow morning with 2 tablespoons of ground flaxseed mixed into your oatmeal, yogurt, or a glass of warm water with a small amount of honey. This is your vascular elasticity foundation. Taken first thing in the morning, it begins reducing arterial stiffness markers over the course of 2 to 4 weeks. At mid-morning, soak 1.5 tablespoons of chia seeds in a glass of water and drink it. Do this each day, and within 2 weeks, you will notice a change in the warmth of your hands and feet. Within a month, your energy levels during light physical activity will begin to shift noticeably. In the mid-afternoon, eat 1 small handful of raw, unsalted pumpkin seeds. These are your magnesium delivery system. Within 3 weeks of consistent use, most of my patients report significantly less dizziness upon standing and more stable energy throughout the day. Every morning, mix 1 teaspoon of pomegranate seed powder or oil into your breakfast. This is the foundation of what I call your arterial reversal protocol. It is the most powerful single addition you can make to your daily nutrition for long-term vascular health. This one takes longer than the others. Give it 60 days of consistent use before you evaluate. The mechanism it works through is slow and cumulative, but the results are measurable. 1 week into this protocol, you should begin noticing improved energy after light activity. By 2 weeks, extremity warmth should be improving. By 3 to 4 weeks, orthostatic dizziness should be significantly reduced. By 60 to 90 days, if you have been experiencing exertional breathlessness, it should be noticeably less frequent and less intense. By the time 3 to 4 months have passed, I encourage you to ask your doctor to recheck your inflammatory markers and vascular assessments. The numbers will tell their own story. Now let me tell you what not to do, because I see these mistakes constantly. Do not use whole flaxseed. It passes through your digestive system completely intact and delivers almost none of its vascular benefits. Always ground, always fresh, always stored cold. Do not roast your seeds. Heat degrades the fatty acids, lignins, and phytochemicals that make these seeds therapeutic. Raw at room temperature, or soaked in water. That is the rule. Do not expect overnight results. This is a 30 to 90 day commitment. I know we live in a culture that wants instant results. But your arteries did not stiffen overnight, and they will not heal overnight. Consistency is the entire game here. And do not use these seeds as a reason to avoid your doctor. If you are experiencing chest pressure, significant shortness of breath, or frequent dizziness, please see a physician. These seeds are tools for daily prevention and support. They are not an emergency intervention. Now I want to hear from you. Have you experienced any of the 5 warning signs we discussed today? The fatigue, the cold hands and feet, the dizziness when standing, the chest pressure, or the breathlessness during normal activities? Type yes in the comments if you recognize any of these. Type no if you have been fortunate enough to avoid them so far. Your response helps other viewers see they are not alone in what they are experiencing. Let me leave you with a thought that I share with every patient who sits in front of me worried about their heart. The arteries are the highways of your life. They carry everything that keeps you going to every single part of who you are. And like any highway, they can be maintained, restored, and in many cases repaired if you give them the resources they need. You are not a passive observer in this process. You are the maintenance crew. And starting tomorrow morning, you have a specific evidence-based plan for exactly how to do that job. So here is my challenge to you. Commit to this 4-seed protocol every morning for 30 days. Just 30 days. Keep a simple note on your phone. Write down how you feel today and how you feel in a month. Your arteries will tell you the truth in a language you will understand. If this video helped you today, please do not keep it to yourself. Hit that like button. Subscribe to this channel so you never miss the simple, straight-talking health information I release every week. And share this with someone you care about, a spouse, a sibling, a neighbor, a friend who has been feeling more tired than usual lately. You might just give them something they have been missing for years. And remember, aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.